The first concern is supplements are not regulated. They do not have proven safety and efficacy. So there's no data, nothing to know whether they actually work. And more importantly, although the majority of them are probably harmless, they can be harmful as well. I can't look after my liver. I need brand supplement X to protect my liver. That's nonsense. It doesn't work that way.
Is this what keeps you busy every day in the clinic?
Spoiler is not.
Dr. Ganesalingam Kanagasabai specializes in gastroenterology and hepatology. He has over 30 years of experience understanding the science of your digestive system and the organs that quietly control how you absorb and function. Puan Nurul Aziah Musa has spent 25 years leading the dietetic and food services team. She's been working quietly in the background, making sure that all our patients get the right nutrients at the right time in the right way. Now they are going to share the secrets to improving your health with simple, overlooked habits that can be done all at home immediately. Liver cirrhosis or liver scarring has been cited as the 9th cause of death here in Malaysia. And liver cancer, a possible outcome of liver disease, is also the 4th most common cause of cancer death and the 5th most common cancer among Malaysian men. My name is Leonard, and today let's talk about liver disease. And joining me today is Dr. Ganesalingam Kanagasabai, consultant gastroenterologist and hepatologist from Subang Jaya Medical Center, and Puan Nurul Aziah Musa, manager of dietetics and food services of Subang Jaya Medical Center. Dr. Ganesh, Puan Nurul, welcome. I'm glad to have you guys here today. So getting started, right? Dr. Ganesh, I know there's multiple types of liver disease. And if you were to simplify it for the public, myself, how would you explain, the question of what is liver disease and what are the types?
It's interesting because actually your liver is the largest internal organ in our body, and it's really like a big factory. So it can get insulted by many things, and as a result of it, it can manifest in many different ways. But I guess simply put, we can probably categorize them into acute diseases where generally it's self-limiting, you recover completely. And the bigger public health problem really will be chronic diseases, chronic liver diseases, generally by definition more than 6 months in duration. So that's maybe the simplest way to understand liver diseases. And the liver can be a primary liver disease, or a liver can be actually really be a bystander from another problem. Even in fact, if somebody gets dengue, for example, you get hepatitis, your liver actually gets affected. So you can actually get affected in many situations. But the main liver diseases that we would see in Malaysia would really be viral hepatitis, i.e. B and C, alcohol, and the largest one today would really be fatty liver, or what is today named as MASLD, which stands for metabolic dysfunction associated steatotic liver disease. That's the huge problem, which we commonly talked about as, or was referred to as fatty liver for all these years. But this terminology of MASLD has really was coined in 2023. And now we always refer to that as MASLD.
Right. And Puan Nurul, with all these 3 main categories of liver disease, are all 3 lifestyle related?
Obviously, MAFLD is related to lifestyle disease because it basically related to our diet pattern, our physical inactivity, our sleep pattern, and our stress related. Okay, and of course, a simple reduction of 5 to 10% of your weight will basically improve the condition of this MAFLD. So that's the reason why it is actually important for you to get connected with your dietitian, because anything to do with metabolic, the first start is usually on improving your diet patterns and your lifestyle.
Right. So there's a lot to talk about today. We've got 3 big categories of liver disease to go through. I want to start with alcohol, and I think that's a fun topic for a few people, right? So here's some interesting data, right? So 70% of Malaysians, given Malaysia being a primarily Muslim country, 70% of Malaysians are abstainers. But among 23% of Malaysian adults are significant alcohol consumers, with younger adults between their 20s and 30s linked to the most riskiest alcohol consumption. So my first immediate question is, how does alcohol even impact the liver, and why should I be worried?
So alcohol impacts the liver in many ways. Okay, and alcohol is basically something that can harm your liver, and it can manifest in many different ways. Of course, it's important to also understand that the majority of people who consume alcohol actually don't end up with liver disease. You're really looking at really about maybe a small percentage actually end up with long-standing chronic liver diseases, which is a huge problem. So you can have something called alcoholic hepatitis, where they're really sick, to somebody with chronic liver disease who end up with liver cirrhosis, and eventually that puts them at a higher risk of liver cancer and liver failure. So yes, and of course the question of what you drink, how much you drink, what is significant and what is not significant. First, let me start by saying that it doesn't matter what you drink, be it beer, be it wine, be it whiskey. The alcohol content varies, of course. So if you take a beer, it's about 4 to 5%. Wine is maybe 12%. Whiskey is about 40, 45%. If you talk about the East Malaysian, their rice wines, it can go up to 60, 70%, right? So basically, to simplify things, we always talk about a unit of alcohol. Okay? And a unit of alcohol, and that again varies from different parts of the world. Most people will take about 10 grams of alcohol as one unit. Some countries use 14 grams. And so a pint of beer, which is about 360 mils, or a glass of wine, which is 150 mils, or a shot of whiskey, which is 45 mils, they all contain a gram of alcohol. 10 grams of alcohol, which is equivalent to a unit of alcohol. So we generally would say, and alcohol does more harm to women than to men. Oh. In the sense that if you take the same amount so men are actually permitted to take a bit more alcohol than women.
How unfair.
Yeah, well, so is life. So for men, we generally would say you can take up to 30 grams a day, and for women up to 20 grams a day. Okay, but that is a level, but less is more. So if you can abstain, that's the greatest, because even the smallest amount of alcohol can do harm. And alcohol is actually a class 1 carcinogen, as is tobacco smoking and many other things, right? So it's actually something that potentially causes cancer, and it doesn't just affect your liver. It really affects a lot of parts of your body. We know that cancer from your mouth right to your colon, your risk increases with alcohol consumption.
Oh, I didn't know.
Pancreatic cancers, all that, your risk goes up with alcohol consumption. So it is harmful in many ways. It's just the harm is just not confined to the liver. So it's actually, so the current thing is, of course, for WHO, and 0 is the best. So you have to drink, or you want to drink as little as you can. So the tagline really is less is more. So you drink less, the more the benefits.
But none is best?
None is best. That's right. And of course, there was this, at one time, there's this talk about, a bit of red wine protects your heart, blah, blah, blah.
I was about to ask you that because I was coming with the study today, and I think the compound is resveratrol. So this pigment in the red grapes specifically, right? So does that not offset the viral nature of alcohol, or is there something to be savored there? So
I think even the benefits of red wine in preventing ischemic heart diseases, or preventing heart attacks, or minimizing your risk of heart attacks is not great. And it's really for a very specific group of individuals where it may minimize your risk. But what is more important to remember is your all-cause mortality actually goes up. So you may maybe lower your risk ever so slightly by from getting a heart attack, but you're probably increasing your risk significantly of all other problems, cancers, everything else. So actually, when you take at all-cause mortality, it actually increases. So I think it negates the benefit of that little red wine that may somewhat protect your heart. Sorry to disappoint you, but yes.
And there goes my investment in the Chianti selection. So now we sort of know that none is best in terms of alcohol, which is going to upset a few people listening in today. But Puan Nurul, nutritionally, right? Does alcohol contribute to any problems we see from a maybe weight standpoint? And I think more importantly, resveratrol and this beautiful purple pigment, shall we say, clearly it has benefits. Are we only limited to then red wine to get resveratrol?
Okay, so from the nutrition point of view, as we know, alcohol carry empty calories. So it doesn't give you any health benefit. But in fact, it actually, like what we discussed, it can lead to obesity. Yeah, and these refined carbs is actually lead to storage of fat, especially
because a lot of alcohol has refined carbs as well.
Yes, it will lead to all these empty calories and fat at your belly area. Okay, in terms of finding food which is high in purple color, okay, the simple thing that we can do is looking at something which is cheaper at the market. You boleh jumpa things like purple cabbage, terung, aubergine, grapes. Those would be a cheaper and of course a healthier alternative. Yeah, because it's whole food in general. Yeah.
So when you say whole food, what do you mean by that? Is there any other thing on top?
Whole food meaning things are not processed. Okay,
Right.
because as we know, processed food are also as carcinogenic as alcohol. So what are the processed food that easily available nowadays? We're talking about any fast food. Yeah, any types of high sugary beverages. Yeah, processed meat, daily meats. So those are actually processed food, which is as equivalent as harmful as alcohol.
Right. So we're not limited to just red wine. We can get it from our terong. We can get it from our purple cobis
Yes.
and all that kind of stuff as well. Fantastic. But, I've seen this whole industry boom, right? With alcohol coming to the mainstream of a lot of people's mind and lifestyle. Then comes in the supplements. And I'm sure there's a lot to talk about here. And one question we see, people asking the dietitians and things like that is liver supplements. Can I use liver supplements? Are they good? Does it reduce my risk for fatty liver? And can I offset my alcohol consumption with supplements? And what do both of you think on that note?
Spoiler is not. Right, Dr. Ganesh? It's not helping out in terms of liver health.
Yeah,
Yeah.
not at all.
Yeah.
I mean, of course, and alcohol, of course, contributes to fatty liver as well. Okay, so in fact, before we talked about the term MASLD, the older term was non-alcoholic steatotic liver disease, non-alcoholic fatty liver disease. That's the first term we used before we changed it to 2020 simply because we found this group of patients who had fatty liver and they weren't consuming significant amounts of alcohol. And that's when they wanted to differentiate those who are taking significant amounts of alcohol causing the fatty liver as opposed to those not consuming significant amounts of alcohol and yet getting fatty liver. So as far as supplements go, they don't help. Okay. So basically, the first concern is supplements are not regulated. They're not regulated. They do not have proven safety and efficacy. So there's no data, nothing to know whether they actually work. And more importantly, although the majority of them are probably harmless, they can be harmful as well. And more importantly, it's not a passport for you to drink, right? And which is what happened. Then you see it on the radio all the time. I'm taking brand X because I drink so much. I can't look after my liver. I don't take care of my liver. I need brand supplement X to protect my liver. That's nonsense, right? It doesn't work that way. And the same thing goes for fatty liver as well. If you look at supplements, the thing you got to ask yourself so to the less discerning, yes, I've got fatty liver, I'll go and get a supplement. The question you got to ask yourself is, if somebody has got fatty liver, I'm not going to use MASLD in this context so that people relate better. I'll just refer to it as fatty liver. If you have fatty liver, what are you more likely to succumb to? Okay, up to 40% actually succumb to heart problems and strokes. Up to 25% succumb to cancers outside the liver. A small percentage of people with fatty liver actually succumb to liver disease. So you taking a liver supplement is really not going to do anything for your brain, for your heart, or your cancers outside your liver. So even if and a lot of the studies that have been done looking at supplements, some of them have actually shown some reduction in liver enzyme, but they've never translated to improvement in scarring, etc., etc. So when it goes back to fatty liver, it all goes back to really lifestyle, weight loss, etc. That is far more important. And sometimes when you take a supplement, it gives you that impression, okay, I'm doing something for my liver. I don't have to do the rest, which is certainly not true.
So there's really no silver bullet that, people can just take and escape.
All hard work.
Right.
Lots of hard work.
I'm really curious from both of your experience, right? We've talked about alcohol. In your practice, has there been any patient that you've seen, that is associated with alcohol, maybe even with the liver supplements, right? What happened to these individuals? Has there been any cases like that before?
Interestingly, I actually have a patient I'm currently managing who works in the alcohol industry. He's been in the industry for years, and he's actually been given liver supplements free of charge all this while he's working in this industry. And sadly, he's actually got liver cirrhosis and liver cancer. Right? It's unfortunate, but so they really, that is not the answer. I mean, alcohol, the simplest thing is to abstain or minimize your intake, because it is harmful. Unfortunately, there's also a genetic predisposition. There's some people who'll argue and say, this guy drinks like a fish and nothing happens, and I drink so little and I end up with liver disease. So of course, it's complicated. It's complicated. It's not straightforward. But I think there is definitely some people who are more susceptible and some people who are less susceptible, and that is a fact.
Right. So safe to say, as we wrap up this section here, right, no alcohol is still the best policy possible. When it comes to social scenarios, then are there alternatives that people should take note of, or is still a little bit every now and then still okay in your opinion? It's sort of like a takeaway.
I think we've all got addictions and vices. Yeah. I mean, for some people, it's a good addiction. You love to exercise, those kind of, there are a few of them who I know somebody who's going on a holiday just to exercise. Okay. So that's a rarity. Some people, it's shopping. That's an addiction, right?
Some people drinking, eating.
Some people drinking, some people smoking. So everybody's got their own vices.
Yeah.
That's a given. So it's whether you can control it. Okay? And there's a very interesting book I read. It's called Motivational Interviewing, Helping People Change. And the one thing that the book says is you will never change only unless you're ready to change. Okay. And for a lot of times, you'll change only when you have this aha moment, when something happens that makes you change. Speaking of aha moments, there's this lady who came one day to our emergency room with excruciating abdominal pain. And we found out she had gallstones. So she went for surgery. And when they opened up to remove her gallbladder, they found that her liver was cirrhotic, hardened liver. And she was well before this. Only problem she had was she was overweight. And she was about 84 kilos. And after her surgery, she was so determined. She exercised 3 times a day. She was working. She exercises before breakfast. Lunchtime, she goes to the gym. After work, she goes to the gym. She controlled her diet. And in about 6 months, she lost almost 20 kilograms, which that did wonders to her liver. But that was her aha moment. Unfortunately, a lot of times when we get to our aha moment, the damage has already been done. And that's the unfortunate thing.
It was too late by then.
It's just like a lot of people who come in with a heart attack and they're smoking. It's only then that they decide to give up something. Of course, you got a few that never stop after that as well. But, so change or to help people change is very difficult. It's very difficult. And of course, everybody's reality is different. We may tell the patient, okay, please go and exercise, eat healthy, but they may not have time to exercise because they've got mouths to feed. They may not have enough money to buy a healthy diet. Yeah. They just eat when they can. So it's hard.
Yeah.
Changing your lifestyle is really one of the hardest things. And it's frustrating because your success rate is, even if the best of intentions, the best of efforts, you're looking at 10 to 20% success rate, So it's tough. It's really tough.
And when we talk about this lifestyle change, it's about looking at your day-to-day behavior. Day-to-day behavior. And from the nutrition point of view, it's not just about cutting everything, making sure that everything is perfect. It's more of making it more sustainable. Because a lot of times, diet is a failure when you wanted to do the very best, cutting down every single thing that you love. And at the end of the day, you realize it's not sustainable because it's hard. You're socializing, you jumpa kawan. So the best is to basically do it small, but making sure that it's sustainable. And I always tell my patient, even if you lose 10 gram a day pun tak apa. Yeah, but slowly, okay? And in terms of diet and eating pattern, it's not just about how much we eat, but it's also what and when, Things like large portion of sizes, frequent snacking, and especially late snacking at night. Yeah, all these, emotional eating, all these can lead to insulin spikes. Okay, and insulin spikes lead to fat storage and leads to overeating because these are not fulfilling. Okay, and of course in terms of physical and activity as well. So these two are the main factor that in terms of lifestyle changes, you got to start with these two first. Simple thing as on your day one, you probably don't need to hit the gym yet, but as simple as 10 to 15 minutes walking after each meal, and at your workplace, try to naik tangga, don't use the lift, as simple as that. Yeah, because as we know, low muscle mass will actually lead to lower metabolism and less movement. You will, use less energy. So probably that is what lifestyle is all about. Yeah.
Right. And I think in the context of liver disease, it sounds like there's going to be a lot of lifestyle conversations that we need to have later on, right? So just to really wrap up the whole alcohol conversation now, really, we know that no alcohol is the best, but if you really got no choice, you don't have to go cold turkey is what I'm hearing, but maybe be very careful with how much you're indulging. And as long as it's sustainable and as long as it's not every single day you're gobbling down, becoming, a fattened liver, then it's fine. Is that correct?
So maybe one of the things that can be done probably is if you have to socialize, try to cap your alcohol for men at 2 units and for women at 1. And one of the worst things, or what we don't really encourage, is binge drinking. And when we say binge, by definition, you're really, for a male, at any one sitting, you're taking about 5 or more drinks. And for women, 4 or more drinks.
Right.
And if you take that in a shorter time period, if you take it within 2 hours or so, that's more harmful.
Right.
So, binge is one of the things you really want to try and avoid as much as you can.
You mentioned 2 to 3 units of alcohol. What does 2 to 3 units of alcohol just look, just for reference?
1 to 2, not 2 to 3.
Oh, 1 to 2, sorry. Try my luck there.
So, a unit would be a glass of wine, a glass of beer, a standard glass of wine and a standard grind of beer, a shot of whiskey. So this is all 1 unit,
But
generally.
Right. And Puan Nurul, do you feel like is there any other drinks that you think, people who want to socialize, but perhaps they don't want to take alcohol? Are there any drinks that you think that they can consider as well?
Usually the tips is to alternate between alcohol and, drink water. So probably those are the tips that usually we've read or you
and
would
also
advise.
because I guess drinking water hydrates you to prevent a hangover.
Yeah.
Right?
Yeah.
So
Water is the best.
I agree. Water is the best. So most people know that, the liver can be impacted from alcohol, as we've just spoken on, and as I think slightly eluded, diet and weight. And many of us today, we've grown up with the hepatitis B vaccination. I still remember those days I was screaming and crying. Why is viral hepatitis then still an issue, and why do we need to talk about it?
it's a very common disease in Malaysia, much less common now than before, simply because we started universal vaccination in 1990, where every newborn child was given vaccination. And so we are not seeing that so much. So prior to that, the main mode of transmission for hepatitis B is really what we call vertical transmission, which means mother to child during delivery. And now that the next generation, we're getting people all vaccinated, we're seeing less. But we're still seeing a fair number of people in the older category who have got hepatitis B. And some of them who also have gone into adulthood in spite of the vaccine. You could rarely get it as well. That's hepatitis B. And hepatitis C, of course, is a virus that was discovered only in 1990. So first to hepatitis, of course, you've got hepatitis A and E, which is really more from food and fecal oral route. B and C are the ones that end up with chronicity. And with regards to B, there's excellent treatment today. So people are doing very well, but we still see a fair number of patients with hepatitis B who present to us with liver cancer. And what is unfortunate is the myth that, or the misinformation that hepatitis B, you're only a carrier, and therefore you do not suffer from the consequences or the complications of hepatitis B, which is really end-stage liver disease, liver cirrhosis, and liver cancer. And interestingly, even if you don't have liver cirrhosis, you can get liver cancer from hepatitis B. So for people who still believe in that statement, oh, I'm just a carrier, I don't have to see anybody, that's totally untrue. So anybody and everybody with hepatitis B must be seen regularly. And after the age of 40, we actually screen them for liver cancer every 6 months. Okay? So men after 40, women after 50. Get an ultrasound scan and a set of bloods every 6 months. And if your virus is active, you actually get treated with drugs which are very effective with negligible or zero side effects. In fact, the current WHO guidelines, and a lot of the guidelines are actually moving towards really treating everybody who's got a detectable virus who have got it with treatment. Of course, that's an evolving field. But importantly, I think good treatment, excellent treatment, anybody with hepatitis B must be seen. Hepatitis C, also, we used to have treatments that wasn't great. Something called pegylated interferon with ribavirin. The side effects were horrendous and people really suffered. But in the last few years, we've had just tablets. 3 months of tablets most of the time, 1 tablet a day, excellent, very effective. But what is happening is we are missing a small number of people who've had hepatitis C but did not know about it. So because the virus was only discovered in 1990, which means people who had received blood transfusions prior to 1990 or blood products prior to 1990 may have actually got the infection from the transfusion and they don't know about it. So sadly, we are really seeing them when they appear with liver cirrhosis or liver cancer years later and we find out they've got hepatitis C. So one of the important messages is really, if you or you know somebody who's had a blood transfusion or blood products prior to the 1990s, make sure they get tested for hepatitis C.
Right. And I know, Dr. Ganesh, I want to go deeper into that in a short bit, but just really quickly, you mentioned very loosely just now that Hep A, Hep E is transmitted through food, through oral consumption, right?
Yes, that's Hep A and Hep E.
Hep A and Hep E, correct. And so, Pran Nurul, when it comes to fecal oral matters, right, in our food, as a dietitian, I suppose, not everyone has that same functioning kitchen in the hospital, which is pristine, right?
Yeah.
But how bad is it? And is this something that people should be aware of? Is this something that people need to be more aware in terms of their hygiene when they prepare food, when they buy food? Most of us eat out these days, right? Is that something we should be concerned about?
Yeah, that's a great question, Leonard. For the general public, good food hygiene actually prevent food poisoning. But from the angle of liver disease, we are looking at it in a much deeper aspect where it's all about making sure that, you eat the clean food because liver plays an important role in terms of immunity and detoxification. So whenever your liver is actually compromised, whether due to fatty liver, cirrhotic and whatnot, so the body is less effective in terms of clearing bacteria and toxin. So what the public should know in the first place, always be careful when buying food. Okay? So do you practice reading food label?
Yes, I do.
Okay, you're a dietitian. Okay. Okay. And looking at expiry date, looking at the packaging condition, you start as simple as that. Make it a habit every time. Okay. And always choose reputable vendors, especially when it comes to ready to eat food. Yeah. And, as much as we work in the hospital, we always emphasize on washing your hand, hand hygiene. So that's the first thing that all of us should practice.
So I realized that a lot of people in Malaysia don't actually really know how to wash their hands. And I was really impatient when I first thought about this, that you've got to be really, really long at the basin, right? So how long actually should you wash your hands for?
So the guidelines is whenever you see a visible soil at your hands, it's basically you need to use soap and water. Okay. So by using soap and water, the right effective way is to basically wash it between 40 to 60 seconds. Okay.
It's a whole song right
there. Yes, a whole happy birthday song. Yeah. And not just that, apart from that, we do not encourage for patients to eat anything raw or undercooked, especially for liver patients, not to have any raw oyster or raw shellfish. Yeah. And of course, in terms of making sure that once you reach home, okay, refrigerate your perishable items immediately, making sure that your fridge is at the right temperature, yeah. And if there's any leftovers, you need to cover it with proper airtight, use it, consume it within 24 hours, and always practice FIFO, meaning first in, first out, yeah. And of course, when you're dining out, I also dining out. I think all of us dining out, yeah. But you have to make sure that you stay alert and check for cleanliness, yeah.
I want to ask about that because obviously if you're going to a well-known chain or a well-known supermarket, typically I would assume that the food hygiene is hopefully pretty good. But a lot of our culture is going to the mamas, it's going to the stalls, right?
Going to the viral places.
Exactly, right? And by the street, for that matter, right? Nasi campur, whatever, right? And some of them are just pop-ups. They come in for the day and they're gone by the night, right? And how they clean is also somewhat questionable, right? But it's an integral part of the Malaysian food culture. So how does a Malaysian navigate all of that when it comes to just being wary about Hep A and Hep E especially?
I think everything to be done in moderation, right, Dr. Ganesh? Yeah. Since let's say for example, a lot of Malaysians, when something new or viral pop up, you will queue panjang nak makan, yeah. And most of the time, nobody talk about viral salad. Nobody, nobody talk about viral food. So basically, not to fall into this viral trap thingy, but more of equip yourself with knowledge. Yeah, anything in moderation will not harm you, but let's not do it excessively.
Right. So don't fall for the food trends, sure. But food that we eat day to day, nasi campur, for example, right? When I want to minimize my risk of getting, Hep A, Hep E being transmitted through foods that's unclean, right? Are there certain foods that are more likely to have a risk of transmitting those concerns to me? Is it better if I go for food that's really boiled, for example, or things like that?
Things like we've mentioned earlier, try to limit or avoid anything raw.
Does it include vegetables though?
No, it doesn't. It doesn't include much on vegetables, but mostly on seafood and shellfish. Yeah. And I probably just want to add on, you probably can always visit a stall or a restaurant chain that will have this license to say that they are audited with certain rating. A, sangat bersih, B, memuaskan, for example. Yeah. So that probably will give you more of confident that this particular restaurant or chain is being visited by the local authority. So that probably what we should think of rather than.
So look for a clean restaurant, make sure that the staff are using protective equipment of some kind, and trying to avoid the raw meats as much as possible.
Yes.
So, Dr. Ganesh, then you mentioned about the history of hepatitis since the 1990s and until today, right? So it sounds like it's something that if I have parents from that era, I should be concerned on behalf of them at the very least. Is that true?
So that's easy to check. Okay, so hepatitis B and hepatitis C, it's just a simple blood test. You can screen, and of course, even in the 50s, 60s, 70s, where people didn't know of hepatitis C, there's always that risk, okay? Because if you had used, people never disposed of stuff. Everything was reused and all that. So there's always a theoretical risk. But the big groups will be really people who have had blood transfusions or blood products prior to the 1990s for hepatitis C. Hepatitis B, I think we're sort of overcoming it somewhat and we're seeing lesser and lesser, and the numbers will drop. In fact, WHO has set 2030 as a target to really bring down the numbers of viral hepatitis.
And that's because of vaccination?
Vaccination for hepatitis B, very good treatment for hepatitis C. Very, very effective treatment for hepatitis C. And on that same note, as far as hepatitis, we don't see much of hepatitis E in Malaysia. You tend to see it more in Nepal, Bangladesh, that part of the world. But hepatitis A, not uncommon, very good vaccine, 2 doses 6 months apart. And hepatitis A tends to be a bit more nasty in adults as opposed to children. So if you already got underlying liver disease, it is important to get vaccinated against hepatitis A, because if you have liver disease and on top of that you do get hepatitis A, it can really turn quite nasty.
Got it.
So that's by just doing a simple blood test to see whether you've got antibodies. If you lack the antibodies, get yourself vaccinated. If you do have the antibodies, that means you probably naturally acquired the infection during your childhood.
Right. So be really clean with your food. If you have concern that you may have gotten a blood product before the 1990s, get screened. I assume for high-risk individuals, including people who use needles, for example, and things like that. Oh,
yes, definitely.
You would also want to get screened. And even if you are diagnosed with hepatitis B or C, there's really good treatments today. Is that correct?
There's excellent treatment for B and C. And yes, one group, big group, of course, we also those who used to inject drugs who have now been clean. It's worthwhile checking for hepatitis B and C and HIV, of course.
So on to the last segment today, right? Right now, as we speak, about half of Malaysian adults are either overweight, obese, and abdominal obesity affects about 53% of fatty liver disease cases, right? That's based on NHMS 2019. And interestingly, what I found as well is, local Malaysian data suggests that metabolic associated fatty liver disease, or MAFLD, is common. According to the Malaysian Society of Gastroenterology and Hepatology, roughly at least 22%, upwards to 37% of adults have MAFLD, or previously known as non-alcoholic fatty liver disease. Is this what keeps you busy every day in the clinic? And are these statistics what you've seen in practice as well?
Well, we see a fair bit. We see a fair bit of fatty livers or MASLD. First thing is to actually change the misconception that MASLD is harmless. So you get a lot of people thinking that, I just got fatty liver, it's no big deal. But few things. First is the association. People with fatty liver, it comes as a package. They've got a higher likelihood of diabetes, high blood pressure, high cholesterol, obesity, and this actually ends up with putting them at a significantly higher risk of heart problems, strokes, cancers outside the liver, etc. So yes, it's a huge problem today. And one of the groups we're really trying to zoom in on are the diabetics. The diabetics, it's a huge problem. In fact, some numbers show that actually up to 70% of diabetics have got MASLD, of which half of them have got significant scarring or fibrosis. So what the studies have shown is, so basically what we're trying to do is identify which are the which are the patients who actually have got significant scarring, or which are the patients that fat is actually harming the liver. Okay, and because 50% of those diabetics who do have fatty liver will have significant scarring, and they say 1 in 5 will actually have cirrhosis. That's a large number. If you look at the big scheme of things, really, it's huge. It means many diabetics will end up with liver cirrhosis and will end up with liver cancer or be at risk of liver cancer and liver failure. And in fact, in America, it's the commonest reason for a liver transplant today. In those days, the commonest reasons were hepatitis C, alcohol, Hep B. But now with such effective treatment for hepatitis B and hepatitis C, MASLD is really becoming the number one indicator for liver transplantation today. So it's a huge problem. And one of the things that we are starting to realize is our endocrinology colleagues as well. Those days when you see somebody with diabetes, we always send them to an ophthalmologist to check their eyes. We monitor their urine for protein and check their heart, get their stress test done. So now what we've added on is something else to look out for your liver. So they're supposed to calculate something called a FIB-4, which is a very simple calculation. And from that, we can sort of zoom in on the ones who have got a risk of progression of disease. And this is a huge group that we're also trying to zoom in on today.
I want to touch on what you just mentioned, which is the FIB-4, right? I don't know what the FIB-4 is. I think most people don't really know what a FIB-4 is. I used to think that you just ultrasound the liver and that's how you determine whether you have liver disease or not. Is that something more robust these days?
Yeah. So your ultrasound can really tell you whether you've got fat or not fat, or no fat at all. And even then, it can miss mild fatty livers. But it cannot quantify the amount of fat. It can, but not accurately. And more importantly, it cannot tell you the degree of scarring until and unless only when it's really bad. When you're cirrhotic, it can pick up on ultrasound. Prior to that, because when we stage scarring, we stage it from something like F0 to F4. So when you're F4, your ultrasound picks it up. But when you're F2, F3, those are the ones that can be missed easily.
And those are the stages where intervention can happen?
Yes. Because the treatment that we have today, medication like resmetirom, semaglutide, they're indicated for F2, F3 fibrosis. So one of the things we're starting to zoom in today is try to figure out who are these patients who are F2, F3, where they would be benefiting from treatment. The FIB-4 is really a simple test because, of course, there's something called transient elastography where we look at the liver stiffness using a special scan. But that's not cheap. It's not very accessible. So your FIB-4 is really a blood test using your liver tests, your liver enzymes and your platelet count and your age, and we can give you a reading. If your reading is, it's just a calculator you can use. And if your reading is less than 1.3, there's a very high probability you don't have significant liver scarring. But if it's more than 1.3, these are people who will zoom in and say, look, we got to put you under the radar. We need to watch you and we need to decide whether you actually got significant scarring with a view to probably trying to do something more aggressive, treat, that kind of thing. So FIP4 is something that we talk a lot about today when we talk about MASLD or fatty liver. It's something you must have a conversation with your doctor or ask your doctor, what is my FIP4? In fact, if you do a lot of lab results, lab tests today in a private lab, they automatically generate your FIP4 for you. And you can tell. So if you're less than 1.3, you're probably okay. If you're more than 1.3, then you got to be a bit careful.
And at what age should people start checking for their FIP4?
As long as you got fatty liver.
Which is everyone.
Yeah, well, those 50% are what in Malaysia who got fatty liver. Make sure your FIP4 is okay.
Right. So for those listening at home, then get your FIP4 checked. Go when you're doing your typical health screening. It's a non-invasive part of the screening process. It's already part and parcel of lab works, and your doctor attending to you can technically tell you whether you are at risk for further investigations or not. Right. Puan Nurul, I want to kind of like turn my attention to you for a bit, and I want you to help the public understand. Right. We talk about weight, and Dr. Ganesh has talked about liver disease, right? But really, what are these lifestyle factors that's plaguing Malaysians so badly today that they attribute to the weight gain and then subsequently to liver disease? Like, how does it all start and what are the main things that we've identified today?
Okay, that like what we've discussed earlier, lifestyle is about monitoring or watching your day-to-day habits, in terms of diet and the pattern, those food that can actually increase fat storage, all those refined drinks. Malaysian, kita suka Milo dinosaur, kita suka teh ais ikat tepi, kau sama bungkus. And sometimes, you've seen it in a mama store where instead of putting it in a glass, they put it in the plastic bag and put mangkuk there. Because why? You can actually have it more. Yeah. Okay. So these are all the lifestyle things that we are seeing in Malaysia. And I also would say in terms of the food apps, food delivery apps nowadays, because it's so convenient to get food. Food are available 24/7 in Malaysia. Okay. In the middle of the night, there will be just you can just go into your food apps delivery and food will arrive at your doorstep. Okay. So these are the things that actually, the environment and the convenience. So it leads to people eating not what nutritious, but what is convenient. Yeah. So these are especially in our urban area, and highly processed, convenient food in terms of busy schedule, limiting to having home cooked food. So these are the things that we need to look at. Okay, personally, it's okay to have outside food, but always making sure that you as simple as go into. Have you heard suku-suku separuh?
I think everyone, yeah.
Everybody talk about suku-suku separuh. So managing your rice portion, and if people say how much you wanna eat, just make sure that it's quarter from your plate, or like your feast size. Yeah, another quarter is protein. Protein will actually give you satiety, and aiming for half of your plate to be filled up with vegetables. Different color, the more color, the merrier. So these are some of the things that we can look into lifestyle, and lifestyle is something that you need to ensure that it's sustainable. Yeah, not just one day you wanted to overhaul your whole life is impossible, and it's not going to happen.
The once a month salad.
Yeah. So and as you know, salad is actually not so pocket friendly. But one thing, being Malaysian, we can always go for our ulam. What are the most cheapest ulam that can easily available? Timun. I think cucumber, is a very cheap sources of food that you can easily get it, or even like typical simple food. Like, have you seen nowadays people actually planting kangkung at tepi rumah, so you can just actually pick your kangkung and blanch it, as simple as that, So this is some of the tips that we can actually tell our patient.
You mentioned about diet and you mentioned about suku separuh, and I think a lot of us have heard suku separuh all the time, right? But when it comes to liver disease, right, is there a particular nutrient that is really responsible for liver disease? I know growing up I was told I was fat. that if you eat a lot of fat and alcohol specifically, you'll get liver disease. And I recall my childhood and my parents cooking food at the time. A lot of the fish were fried, a lot of the chicken were fried. Is that true? And on the topic of fat, then we hear things like, if you take the MCT oils, for example, right, or the extra virgin coconut oils, then your liver disease risk will go down or things like that. Is there any truth to that?
Spoiler, no, it's not. Yeah, it's not. So in general, we talk about reducing our saturated fatty acid oil, yeah. And in terms of deep frying, as you know, Malaysian, we love anything deep frying, right? So some tips that you can use at home: try not to use your cooking oil for more than 3 times. After 3 times of usage, you need to discard your oil. And generally, of course, palm oil is one of the best cooking oil for deep fry. Yeah, but of course, we do not emphasize on having deep frying every day. Try some other method of cooking, things like grilling. Nowadays, people are into air frying. So those will be some of the healthier options of cooking method that can be done. Right. Yeah.
So fat plays that role purely because it impacts the liver directly, or is it just a factor of calorie surplus and you gain weight and then you get liver disease?
Your call.
I don't think in particular. I think the important thing is it's a healthy, balanced diet, right? So we basically, when you talk about fatty liver, one of the diets we really promote is something called the Mediterranean diet. And that's really basically, lots of fish, lots of fruits, lots of vegetables, legumes, olive oil, that kind of thing.
Salmon.
Yeah. So that's more important, I think.
Right.
And what is also important to remember is that we try to get at least 5% weight loss to move away the fat. And we say if there is inflammation from that fat happening in your liver, if you can lose about 7 to 10%, the inflammation comes down as well. So 5% weight loss, significant fat loss.
Right.
7 to 10% inflammation comes down. 10 to, if possible, 20% scarring comes down. So it's actually quite reversible.
Right.
You can reverse the fat, the inflammation, and the scarring with the hardest thing to do, which is weight loss. So.
And 20 to 30% fat loss, you get 6-pack abs.
Yes, dream on. yes, definitely.
But I want to touch base on that, right? Because there are 2 key things I want to ask. You mentioned the Mediterranean diet. Now, Puan Nurul, I can't imagine myself buying salmon every single day. Yep. I just don't think that's a financially smart decision, right? How does the average Malaysian then embed the Mediterranean diet? Is there a Malaysian appropriate Mediterranean diet then?
Always choose fish, I would say. Yeah, ikan kembung is equally good and is one of the cheapest sources of ikan that we can easily get. Yeah, and unfortunately, ikan patin, although is a little bit, ada lemak, but it's not really omega-3. Yeah, and apart from that, if it's not salmon, chia seed is also a very high source of omega-3. Yeah, and of course your nuts and your legumes.
Right.
Yeah. So basically, it's not just salmon entirely. But one thing about Mediterranean diet, of course, is proven. It can help to actually give you give you good in terms of your overall health benefit. Yeah.
Right. So get a good quality extra virgin olive oil. You don't have to use salmon. Aunties, you can use tenggiri, ikan parang, kembung, and so on and so forth.
Yes.
And that's all perfectly fine.
Yes.
Air fried, right?
Yeah.
You mentioned weight loss, Dr. Ganesh, 5 to 10%. For the average Malaysian, right, Puan Nurul, from your experience, from both of your experiences, right, if I am the average Malaysian that is overweight, obese, if I just change, is it as simple, like put it quite straightly, right? Is it as simple as changing all the deep fried stuff in my diet and my sugary stuff to less sugar, non-deep fried? Do you think I'll achieve that 5 to 10% weight loss?
It's actually bigger than that, not just focusing on the oil instead. Okay, one thing that will actually really do help you is in terms of avoiding sugar. Don't you think so, Dr. Ganesh?
Oh, yes.
Start as simple as avoiding sugar. Things like your bubble drink, your teh ice, you cut it down completely. And by reducing sugar, it will basically help to, fasten your weight loss. And of course, at the same time, you need to look for something that will promote satiety, that will give you rasa kenyang yang lebih. So what are those things that dietitian will usually advise, fill up your plate with half of vegetables and making sure that you always include protein in your diet, okay? Because protein will actually enhance satiety. So what would be good protein? Fish, chicken without skin, legumes, tofu. So those are good sources of protein. Yeah, so probably we can do that and try to avoid late night snacking. Yeah, and fruits is also good choices of whole food.
And I think people have got different ideas of what people have decided what they're taking. They think is normal and healthy when actually it is not.
Yeah.
So when you ask them, why is your weight not coming down? What do they say? Oh, I'm really trying to control. And then when you tease the diet down, breakfast will be nasi lemak with kuih, and then lunch will be
Roti
rice with
canai.
curry, and then dinner will be rice again with curry. But they say,
Banjir.
but they say, I'm not eating in between. I'm just eating. But your meals, that's a lot of calories. So you really need to, like what Nurul said, your suku sparrow.
Yeah.
Your sparrow cannot be nasi,
Yeah.
Suku's got to be nasi.
And your suku rice cannot be banjir, Although it's just, but banjir.
Timbun.
Banjir how?
Tapi banjir sayur boleh lah.
Banjir
Yes.
kuah.
Banjir-
Things like, dal.
Yeah.
It's basically double carbohydrate on your rice. Rice is already carbohydrate. Dan lepas tu kuah dal penuh sama, banjir sama, that's it, gone. Your suku sparrow wrongly interpreted. Yeah, koyak.
And of course, they got now different things like intermittent fasting, time restricted eating. That's something which is
Worth to try.
very doable.
Yeah.
And so
Does that actually work for most Malaysians, you think?
it does. I mean, of course, I don't know how much evidence. Your weight loss may not be the greatest. You may not, but it's a very healthy lifestyle. And sometimes it's easy. And then you say, okay, that 16 hours you're not taking any carbs. You're really drinking, plain tea or something. And then 8 hours that you eat, you try to be healthy in what you eat.
Yeah, but just playing devil's advocate here a little bit, two questions, right? If I have gastritis, for example, wouldn't that then not be suitable for me?
No.
And the other thing is, I've seen this myself, right? Friends who swears on one meal a day or intermittent fasting, right? They don't eat at all for 16 hours, but that 8 hours, the way they gorge is a sight to be seen.
Okay. So yeah, of course, all in moderation, of course. And in a case, I don't know what is the fact that, there's also this myth, or every time a child doesn't eat the first thing the mother will say is, you're going to get gastric today. All this doesn't help. So our stomachs are very hardy, You can actually take, unless of course when you don't eat and you starve, you have significant side effect. Not eating for 16 hours is not going to give you an ulcer or do anything like that. But if you've got symptoms from not eating for whatever reason, you can't tolerate, that's a different story. But doing time restricted eating has got a lot of benefits, a lot of physiological benefits, and it's certainly not going to do any harm. Of course, if you're cirrhotic, we don't encourage it. Because people who have got cirrhosis, we tell you to actually eat 5 to 6 meals a day, simply because otherwise you end up losing muscle mass. And as we age, we all lose muscle mass, and that's already a struggle. So, when you see somebody who's slightly older and you tell them to hit the gym, they're very surprised. They said, they feel like, how can I even go to the gym? But that's extremely important. Resistant exercise becomes so important when you age, because we all lose muscle mass as we age. And when you got enough muscle, you don't end up being frail when you're old. So all that is important. And of course, diet, protein, all that helps.
You brought up a really good point. And we've talked about diet, and obviously the suku separo, the portion control, calorie control, it's going to help a lot, that 5 to 10% weight loss. But now you brought up a really good point, which is resistance training. And that context you just cited was for the sarcopenic or the elderly population, right? But for liver disease, for example, is there any good evidence for resistance or strength training?
Oh, yes. So a lot of patients who are cirrhotics, we actually tell them to do some resistance training as well. And one of the things we also encourage, one of the reasons we tell you to have frequent meals is when you starve, you burn your muscle very easily because your liver cannot produce the glucose. So in fact, sometimes we say if a normal human, if somebody with liver cirrhosis starves for 12 hours, it's like a normal human being starving for 3 days.
Right.
That's how much harm it does. So we always even encourage somebody who's cirrhotic to take a pre-bed snack. You have something before you go to bed so that during your sleeping hours, you have a source of energy. Otherwise, so we actually encourage them to even do resistance training with people with liver cirrhosis because we want them to maintain their muscle mass because they burn their muscle very easily.
Right.
You know?
And for people watching who perhaps are imagining Arnold Schwarzenegger in the gym lifting huge amounts of weights right now, what is the type of resistance training you recommend to your patients?
Anything you're comfortable with. Of course, you got to be careful, especially if you're in the older age group. You don't want to harm yourself. You're most susceptible. And of course, cardiovascularly, make sure if you've got heart problems, make sure you run it by your cardiologist. Make sure you're allowed to do what you're allowed to. Nothing too strenuous, enough to maintain your muscle mass. And sometimes it's even not a bad idea to actually get somebody to teach you how to use your machines before you actually embark on a proper training program.
A personal trainer might be even helpful.
That's
as
right.
well.
They're not cheap, but it's something sometimes worthwhile just to know how to get things done. And then you can continue on your own, of course.
Right. And Nurul, with resistance training and exercise, right, how should Malaysians sort of like use that as a tool when it comes to managing their weight? And, a lot of people obviously think like, if I'm going to work out like mad today, I have the ticket to go to the buffet. How should people think about it?
Okay, talking about exercise, I think the first thing that anyone can invest is on having a smart watch where you can actually track your steps. Yeah, and we are talking about aiming 10,000 steps a day. And I think we work in the hospital, sometimes we realize, we think that we have walked so much in the hospital. But by the time when you see, it's not even 5,000 steps. Yeah. So investing on a smart watch will actually help to track, to keeping you active. Yeah. And the second question again, sorry, was
like how can people use exercise as a tool to manage their weight? And how should people go about it? Because the way I see it in the public is people exercise today, they join a group class, and that means I can have my roti canai later, right? What's the thought process there?
So I think the most important thing is to actually learn how to calculate your calorie. That's very important because you dah buat exercise, then lepas tu you indulge and you go and do binging. Rugi, koyak, yeah. So, and there's a lot of nowadays food tracker apps where you can actually install in your smartphone, where you can actually key in, what you consume, and from there it will actually help you to sort of like monitor, how much calorie you should take in a day, and if you have taken, so you ada balance berapa banyak, yeah. So that's one thing that anyone can invest on.
So don't go crazy after a workout. Know your calorie requirement
Right.
and be careful to check on it. It doesn't mean that just because you've exercised, you should go in and gorge yourself, right?
True.
I want to just talk about one last thing before we close, right? Which is the fact that we've talked about lifestyle change, diet, exercise. This all sounds really simple things to do, but as we all know, the things that are easy to do are also easy not to do as well, right? And previously, Dr. Ganesh, you talked about off screen just now. You mentioned about motivational interviewing, and people need some form of motivation or some reason why they are going to embark on that journey of transformation, right? I've seen people who says they're going to lose weight this year, and 2 weeks later they're at the alcohol bar, right? What have you seen to have worked really well, and what do you think are those really interesting factors that leads to it?
So I think it's easy when they have an aha moment where it's a scary event, something happens and they change. Often that's what it takes. But sometimes people are willing to change, but they must want to change. So if they are at that stage where they're not considering change, no amount of force, scolding or frightening them or what is going to do anything, sometimes it just puts them away, and the relationship just drifts apart because they're not ready to change. And sometimes it's also delving into why they can't change. It may be, their realities can be different. They may not, there was a guy I met the other day who had put on 10 kilos. And he says he finishes work at 12 midnight every day. He just goes back to sleep and then he goes to work again, right? He says weekend, he's just catching up on his sleep. So it's very hard. So I think it's only when they're ready to change, then you start exploring ways to change them. And again, whatever they do, be it diet, be it exercise, is something they enjoy and something Nurul said, something that they can sustain, that becomes extremely important. We have had a few success stories with alcohol where people have, and unfortunately, they become very sick for them to actually stop the drink. But what's sad, there's a small number of them, once they've recovered, they forget and they go back to the drink. That's with anything. So a lot of times there's also support groups, continuous and family support. All that actually plays a role. So it's actually not just the individual, it's a lot of people that need to play a part. And it's hard. This time and age, it's not easy.
I think we've covered quite a fair bit today. And I think what I've learned tremendously is that, it's not as straightforward as liver disease is just alcohol. It's clearly a lot more than that. I think the biggest issue plaguing us today really is the lifestyle factor of how, Malaysians are impacting into liver disease. And there's a lot of things we can do. But just to quickly wrap up and, just to provide the audience listening some key messages, right? I'm going to start with Nurul first and maybe thank to you, Dr. Ganesh. Do you have a quick or a short key message that you'd like to share with the audience today as a takeaway?
So the takeaway message here, nutrition is not just about weight. It's about preventing disease and it's about enjoying food. And of course, at the very same time, you have to be very modest and equip yourself with knowledge. I think food is something that socially people enjoy, but sometimes you tend to abuse it. When you love a certain types of food, then you go all out having it every alternate day. So that is actually not advisable. So there's no actually good food or bad food. It's just a good diet and bad diet. As much as you being young, healthy, you boleh makan apa saja you nak, but always keep it in moderate quantity. So that would be my take-home message when it comes to food. And a lot of time people are afraid to see dietitian. Janganlah takut jumpa kita baik saja. But of course, bila jumpa dietitian, kita akan advise what would be the right food based on your medical condition. Okay.
So if you have a diet-related problem, don't be afraid to find a dietitian, right?
Yes.
And Dr. Ganesh, what would be your takeaway today?
And the liver is an amazing organ. It's got an amazing capacity to regenerate. In fact, when we do a transplant and we actually take off, the right lobe, which is about 60%, within a month, it grows back to its original size. But it's also something that if you knock it often enough, one day it will fail. So be it from your lifestyle, alcohol, diet, fat, all that, eventually one day, it's a very slow process, but eventually it will fail. So I guess it's respect your liver and look after it very well. Otherwise, one day, bungkuslah.
Fantastic closing. Bungkuslah. Thank you so much, everybody. Thank you so much.
One last thing,
yes.
Coffee.
Coffee. Yes.
Tell your patients to drink lots of coffee. It's good for your liver.
Help me understand that very quickly in 30 seconds. How does coffee benefit the liver?
3 cups a day, minimum, helps you with, reduces fatty liver, reduces risk of liver cancer. Whether it's caffeinated, decaffeinated, something called polyphenols helps you. But of course, you get palpitations or you can't sleep, don't take your coffee. But if it doesn't, enjoy your coffee black. No sugar, no milk.
So respect.
Cheers.
Cheers.
So respect your liver. If you have no palpitations, take your coffee. It's good for your liver as well. And if you're worried about your diet, be sure to book an appointment with a dietitian sooner than later. Thank you so much, Dr. Ganesh. Thank you so much, Nurul.
Thank you.
Thank you.
Now, if you've been listening today for the entirety of the episode and you feel that there's a lot of questions burning inside of you, we've got links down below for you to book an appointment with a doctor or a gastroenterologist. And if you have lifestyle challenges with your diet, the way you live and sustainability, you can also make an appointment with our dietitian and the links are all below once again.